Hey, everybody. Dr. Dana Gibbs here. So today I want to answer some questions that I've been getting about my new direct specialty care practice that's here in North Texas. And first, what I want to do is tell you guys a little bit about why I switched to the direct care model in the first place. So there are several reasons why this is a better way to provide the kind of high level personal care that I want to provide to people. And what I'm going to do is I'm just going to give you the insurance way and the direct care way, side by side comparison. So here we go. All right. So in an insurance model, to see a specialist, you might have to wait months for an appointment, 3 to maybe 6 months sometimes to see an endocrinologist. So yeah, what's up with that? Anyway, the direct care way, you can be seen within a week or even days. So in my practice, I have discovery calls that are available this week. What about time efficiency? Well, if you go to an insurance-based practice, you might have to wait for insurance approval before you can move forward with the needed care once you even get an appointment with the doctor. Or they might tell you have to return a different day because the insurance won't cover the visit and the procedure on the same visit. Or the insurance might actually deny what the doctor wants to do and insist that you waste months trying cheaper therapies before qualifying for higher quality or more innovative therapies. Whereas in a direct care practice, you choose what care you need in collaboration with the doctor. And you can go ahead right then instead of having to pick some alternative treatment because that's what's covered versus what's not. All right. What about pricing and costs? Well, in an insurance model, you're never going to know in advance how much any particular care is going to cost you or whether it will for sure even be covered. And you might get a bill weeks or months later because insurance wouldn't guarantee and they denied the coverage to the doctor. In a direct care model, you've got transparent and upfront pricing. It's agreed upon in advance, paid in advance. There's no billing later, no surprises later. The next one is in an insurance model. Because of the reimbursement rules and the declining reimbursement, doctors are really forced to focus increasingly on the procedures that reimburse them the best and spend the least amount of time possible providing you with that care. Whereas in a direct care model, the doctor gets reimbursed by you for the expertise and the time that you're spent. So there's no pushing for expensive and possibly unnecessary procedures. And what you get is expert care. All right. Also, with an insurance, you get a limited network of choices for referrals to radiology or other specialists or other facilities. Because with increasing frequency, the insurance companies or the hospitals actually own these doctors or these clinics, the better to maximize their own profit. Whereas in direct care, you get an unlimited choice of what other providers are needed for your procedures and your other care that the doctor is not going to provide to you. And frequently much better prices. For example, last year I needed an MRI on my knee and I was informed that my insurance wasn't going to cover it and that they wanted me to do some other thing and go through months of physical therapy and all that. And even then, the MRI was going to be like a $1,400 copay. Well, I called the radiology place up and I said, okay, insurance doesn't want to cover this, but I already have the surgery scheduled. So what's it going to cost me? $400. Well, that's a no-brainer, right? Okay. And then there are going to be, in an insurance-based model, there are going to be limited choice of options for your care because insurance-based healthcare is really sick care. Whereas in a direct care model, you have access to innovative options for holistic and integrative care, sometimes coaching, nutrition, acupuncture, and lots of other less traditional modalities if you and your doctor decide that's what you need. And what about access to care? Well, in an insurance-based model, you have a lot of discontinuity of care these days. Your access to your doctor is very, very limited. And you might even have to go to urgent care because you cannot get timely attention or a needed prescription or answers to your questions. Whereas in a direct care model, you're going to get quick access, direct access to your physician to get your questions answered and not needing to make an appointment just because your doctor won't refill your prescription because your doctor has choice in how they get reimbursed for their time spent, regardless of whether it's face to face or not. Then the next one, the last one that we're going to talk about as far as the direct comparisons are the discontinuity in the interference in the doctor-patient relationship in an insured model. So if you even get to see a doctor and not a mid-level or a nurse, doctors in insurance-based care are generally overworked, disillusioned, and restricted in what they can do for you and the time and the care that they can provide for you. Whereas the doctor-patient relationship in a direct care practice is between you and your doctor only. And direct care doctors tend to love their work. That's why they're still in it. They see fewer patients, so they may not mind even filling out a prior auth for you so you can get a needed medication since it's much less of a frequent process. Anyway, so if that's not enough, then here's some stuff. Why should you pay a direct care doctor cash when you have insurance? Well, here's another reality about insured care. You actually get a ton more value for the dollars that you spend in direct care. And that's happening in more ways than one. Here's the first one. A physician who takes insurance has to spend a huge chunk of the dollars that are paid to them because they have to hire a whole group of extra staff or even consultants to do what? To deal with the insurance company that is paying less and less of the cost in the first place. So for what? Well, okay, pre-approval and insurance verification, because people's insurance can get canceled without notice if they don't pay premiums or if they lose their job. And then coding of the diagnosis and procedures. Most doctors do not do this themselves, and they have to pay a staff member to do it. Also, the same staff member makes sure that the documentation matches what the doctor is asking to be paid for. And I'm not even going to talk about the time the doctor has to waste dealing with the EMR these days, since it's required by insurance. And then billing. So billing the insurance companies, the primary, and then maybe even a secondary, and making sure that the reimbursement matches what the contract is, because insurances have whole departments that are coming up with new ways to get away with paying the doctors less. And they know that a lot of doctors will not even check to see if they're getting paid. I mean, that's like going to the grocery store to buy a steak and the steak is $7.99 and you slip the cashier $4 and the cashier doesn't ask you for the rest of the money. It's just ridiculous, but it happens to doctors all the time. All right. So then when your insurance company either pays the wrong amount or denies the claim inappropriately, then somebody has to follow up and work those denials. And then if they still deny it, then they have to pay somebody to badger you to collect the money or to hire a collections company when the insurance eventually doesn't pay and you actually got a legit service and they're owed that money. But then when other patients run out on their bills, then even more of your money is going to pay all those costs. All right. And let's talk about that EMR just for a second, because your insurance company and your government insurances in particular require now that that a doctor use an EMR. And it's a huge and mostly unnecessary expense otherwise. It's also really expensive in terms of the physician's efficiency and the time that they have to spend face to face with you, because the EMR is designed primarily to make sure that hospitals are getting paid for every vial of fluid, every IV, every bandage, and every second of nursing care that they provide to you. And the doctor is the one who gets stuck documenting all that stuff. And then if you go see a different doctor, then your new doctor is going to have to read through all that raft of documentation just to pull out the 2 or 3 lines of the meat of what you went to the doctor for and what they did for you. That's huge as far as an expense for the doctors to face. Here's another thing, because insurance reimbursement has really dropped phenomenally for face-to-face time with the doctor over the years, and it has never paid for non-face-to-face time. So far from keeping up with inflation, insurance companies repeatedly cut reimbursements a little at a time, year after year. And in real inflation-adjusted dollars, most things doctors do today pay about 30% of what they were paid 20 years ago, if that. And this is especially true in the small independent physicians' offices and in primary care disciplines like internal medicine and pediatrics and hormone care, because hormone care is a subset of internal medicine most of the time, where there are not that many procedures. It's mostly intellectual diagnosis work and interpretation of lab results. So these kind of doctors, especially that are not in the high turnover procedure-based specialties, work to make up for this with increased efficiency and productivity, meaning, short answer, they have to see more and more patients each day, which gives each person less and less time with the doctor. And they have to do that just to keep the doors open. And so they just don't have time to give each patient the personal attention that they deserve. So hiring mid-level providers does help them do this, see more patients in less time. But these workers just don't have the same training or diagnostic experience or medical decision-making capacity of a well-trained doctor or specialist. So these providers prescribe more short-term fixes like antibiotics, for example. They overtreat with prescriptions that aren't necessarily indicated. They order more and more unnecessary tests. They waste more and more of your time and money, and sometimes leave you dangerously undiagnosed or underdiagnosed. So I have a friend who is also a direct care specialist, and she was telling us a story this weekend about a patient that she saw who had been to urgent care and been to a clinic and left that clinic undiagnosed with a referral several months in the future to a rheumatologist. And this patient came to my friend, and it turned out they had given her a bunch of steroids that had thrown her into a life-threatening condition called diabetic ketoacidosis, where you have to go to the hospital and get IV insulin. And it's really, really dangerous and frequently deadly if it's undiagnosed. So the depth of diagnostic and clinical acumen that you can get, and this was over a virtual visit, that she was able to diagnose something that the hospital and the urgent care had completely missed. But anyway, so what happens when the efficiency in a clinic is all completely maxed out and the doctor still can't make enough money to take care of their family and pay their bills? They end up having to sell out, frequently to the very insurance companies and hospitals that squeezed them in the first place. Or if they're in so deep in debt that not even the hospital wants them, then they just shut their doors and quit medicine altogether. And this is happening at an accelerated pace all over the US, particularly since COVID happened. And what's up with this trend of insurance companies being able to own medical practices? How is that even legal? I don't get it. And then there's one other thing that I want to mention about direct care that I really don't see in insured medicine. And that's that there aren't many doctors who have time to follow innovations and updates particularly in hormone care and diagnosis, and particularly for fringy, reimbursed topics like Hashimoto's disease effects on your body, or the interactions between stress and thyroid and the rest of your body hormones, or particularly these days in the setting of menopause or testosterone deficiency in women, which is pretty much completely unreimbursable by insurance? Or what about the updates in microbiome science so you can know which supplements out there and which new inventions and interventions are worth your money? So even many endocrinologists do not have the full picture of this, or we're taught methods and dogma that are really outdated now. And really, none of these things are secret. And as a matter of fact, I run a course in a discussion group for doctors where I'll teach anybody who wants to learn. But so far, the only doctors who have been interested in this and have the time and energy to come and learn are those who are in direct care practices. All right. So let's face it, it is a time consuming and complex process, what I do. So I figure out what's going on with people's hormones, work out the details of the individual plan that will work best for you, while also minimizing your risks and side effects, and then educating you so you understand the why of the recommendations and the alternatives. So that's what you get when you see a direct care specialist, because you and the doctor are the only ones in charge of that process. So it's a much better way to pursue the regaining of your health rather than just which pill is possibly going to alleviate the primary symptom that you showed up with at the doctor's office right this minute and save your insurance company the most money, of course. Of course, it's an investment, what I do, in your time as well as in your dollars. But what better way to invest in yourself than to achieve your very best health? All right, that's it for now. I'm Dana Gibbs, MD. I'm an integrative physician in North Texas, where I help people address their complex thyroid and other hormone imbalances. If you want to find out more, you can check out my website. And I actually have discovery call openings this week. So if you have exhaustion, weight gain, chronic pain, or other hormone imbalance symptoms, I can help you. My website is www.danagibbsmd.com. And I am so excited and just waiting to see you. Take care and have a good week.